Well, I want you to think about it. Each year in America, medical doctors, according to the Center for Disease Control, according to the Journal of the American Medical Association, each year in America, medical doctors kill, injure, and infect 15 million Americans in the doctor's workplace, clinics, and hospitals. 15 million a year killed, injured, and infected in doctor's workplace. They all get a walk. So the best thing you can do to save your family, your workmates, your neighbors, your church mates, is to take care of them yourself so they don't have to go to a doctor. Okay? So what are we going to do? I want you to get a hold of this new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Epigenetics, The Death of the Genetic Theory of Disease Transmission. And basically it talks about the fact that to reach our genetic potential for health, for longevity, for wisdom, fending off disease, we have to give our genes, our DNA, and RNA all the raw materials they need to achieve that maximum benefit, okay, for longevity and health, wisdom, and so forth, fending off disease. Well, what are some of the diseases we're talking about? Is this a theory? No. This is drop dead, proven with billions, literally billions of dollars worth of research, absolutely billions. I can prove that. And so why don't your doctors do these things? Well, there's no law requiring him to cure you when there's a cure available. He makes more money for treating you for years and years and years rather than curing you in a couple of weeks. So look at some of the diseases that you can make your family, your neighbors, your workmates, and your church family free of these diseases in 2 months or less. Let's look at some of them. How about type 2 diabetes? We've known for 70 years that type 2 diabetes is a simple mineral deficiency disease, and you just take, we like to take the 90 essential nutrients, and you take our secret sauce, which has the missing pieces of the puzzle here, and you're going to support and promote healthy sugar metabolism, healthy sugar values in your blood, healthy blood sugar levels, healthy sugar, carbohydrate, and fat metabolism at the cellular level. Take your fasting blood sugar every morning before you medicate yourself, and as your blood sugar drops, you take less and less medication as your doctor has taught you. When you get your blood sugar down below 100 for 5 days in a row without medication, you're an ex-diabetic. And, of course, you have to stay on the 90 essential nutrients just for maintain yourself, because after you deal with your blood sugar problems, your A1C hemoglobin, guess what? There still won't be these nutrients in your food. Same thing is true with high blood pressure. High blood pressure is not genetic. Arthritis is not genetic. And my doctor says you can't regrow cartilage. Well, that's not true. You can support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And again, within 90 days, you should be able to have your family, your neighbors, your workmates, and your church family arthritis-free. What about asthma? Oh, my gosh, asthma is a simple nutritional deficiency. It's almost always secondary to an underlying problem called gluten intolerance, because you cannot absorb that nutrient when you have a gluten intolerance. So you get the individual, regardless they're a 50-year-old guy, a 100-year-old guy, or a little kid, 3 months old. You get them on a gluten-free diet, no wheat, barley, rye, and oats in any way, shape, or form. That includes the cat, the dog, etc. And then you get them on the 90 essential nutrients appropriate for body weight, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids appropriate for body weight. And usually within 2 to 4 weeks, they're asthma-free. I've seen it happen thousands of times. Obesity. We're the number one obese nation in the world, following the doctor's instructions, the government's instructions. Obesity is not eating too much. Obesity is not lack of exercise. Obesity is truly a simple nutritional deficiency. Go into great details in the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. And obesity, you should be able to lose a half a pound to 2 pounds a day. You can lose 140 pounds in 100 days. You can lose 60 pounds in 45 days. This goes on and on. We do this literally thousands of times a month across the world through the longevity system. I urge you to get on the 90 essential nutrients appropriate for body weight. Add to that the ASAP under your tongue 30 minutes before each meal, and you'll begin to lose a half a pound to 2 pounds a day. And you will love yourself 2 weeks later, 30 days later, a month later, 60 days later, because guess what? As long as you stay on the 90 for Life program, you stay on the 90 essential nutrients appropriate for your body weight, you won't gain the weight back. That's the magic. You won't gain the weight back. So let's recap here. Diabetes, high blood pressure, arthritis, asthma, obesity, many, many other diseases. We're talking about things like lupus, which is a simple disease that's secondary, again, to a gluten intolerance. I can describe that for you, because when you have lupus, you have this rash on your face called a lupus, sort of butterfly rash in your face, SLE, right? Systemic lupus erythematosus. That's this red rash on your face. That's classic for a gluten intolerance. You get on a gluten-free diet. You take what we call the Healthy Bone and Joint Pack, and some extra of our selenium. You're going to give your body all the nutrients it needs to support and promote maintenance and repair of connective tissue, cartilage, ligaments, tendons, disc between your vertebrae, bone matrix, bone itself, skin, everything else. You'll be amazed what happens when you can absorb nutrients. Think about it. If you have the symptoms of a gluten intolerance, you are going to have a struggle, because a lot of people say, oh, yeah, I can take a whole bottle of aspirin and it won't help my headache. Well, they got an absorption problem. Get gluten-free and be careful. You better, when you get gluten-free, you better drop back down, instead of a bottle every time of aspirin you want to try, just one, because you'll be able to absorb it and it'll work. It's amazing how that works, okay? Don't forget my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. And guess what? You'll stay away from doctors and save yourself. Why be one of those 15 million who are killed, injured, and infected each year by medical doctors in their workplace? Wow. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I want to talk about a CNN story that's headlined 15 diseases doctors often get wrong. According to Dr. David Fleming, he's the president of the American College of Physicians and professor of medicine at the University of Missouri, a fine institution. They say a lot of symptoms are nonspecific and variable depending on the person. On top of that, many diagnostic tests are expensive and aren't done routinely. Even then, they don't always give us a black and white answer. So those 15 diseases are IBS. They say it's because there's no real test to prove the existence, rather they require a diagnosis of elimination. They say, according to diagnostic criteria, a patient should have symptoms for at least 6 months before they see a formal evaluation. Celiac disease is number 2 on the list. Much confusion surrounds celiac disease and immune reaction to gluten that triggers inflammation in the small intestine. It takes an average of a patient 6 to 10 years to be properly diagnosed.
Oh, Lord.
Yeah, there you go. Fibromyalgia, say characterized by widespread musculoskeletal pain involving medically unexplained symptoms. Rheumatoid arthritis, unexplained aches and pains may also be associated, caused by rheumatoid arthritis. In autoimmune disease, say early stages of RA can mimic other conditions. That's why it's often missed. They go on to say multiple sclerosis, another autoimmune disease, often occurs when the immune system attacks its own nerve cells. First symptoms of MS are often numbness, weakness, or tingling in the one or more limbs. They say, but it's not always the case. Lyme's disease, they say you look out for tick bites and the telltale bullseye rash that can form around the infection. But they say not everyone develops this. This rash, they say blood tests can check for Lyme disease antibodies in the blood, but those don't usually show up until weeks after the infection, and the test is notoriously unreliable. Lupus, most distinctive sign of lupus, as you were describing, the butterfly-shaped rash on the cheek. And they go on to say polycystic ovarian syndrome, irregular periods, unexplained weight gain, and difficulty getting pregnant can all be symptoms of polycystic ovarian syndrome, a hormonal disorder. And the appendicitis, inflamed or burst appendix, should easily be identified. They say the typical appendix symptoms include nausea, pain, and tenderness around the belly button, and possibly a low-grade fever, but not always. Endometriosis, they say menstrual pain and discomfort, often misdiagnosed. Women with endometriosis often report pelvic pain, cramping, heavy bleeding, and that's far worse than usual, and it gets worse over time. A pelvic exam can sometimes detect it, but ultrasound or laparoscopy is required for a definite diagnosis. Migraines, they say severe headaches characterized by throbbing, pulsing, can be accompanied by nausea and sensitivity to light, but some people who get migraines don't even know it. I don't know how you would have a migraine and not know it, but they say cluster headaches, often misunderstood as extremely painful and also very rare. Hypothyroidism, the underactive thyroid gland produces insufficient amount of hormones to regulate weight, energy, and mood. It can mimic depression, fibromyalgia, and other conditions. Type 2 diabetes can stay hidden forever. It can cause life-threatening damage to the body's major organs. Inflammatory bowel disease. There are 2 types of IBD, Crohn's disease and ulcerative colitis. Both cause inflammation in the digestive tract, as well as pain, diarrhea, and possibly even malnutrition. So there you go. There's the 15 that they miss, and those are some of the most common diseases that we see coming up on this radio show ever since I've been involved for the last 15, 16 years.
Yeah, and of course, the reason why people come to us is because 5 or 6 or 8 or 10 or 12 or 20 doctors have misdiagnosed them. We're just treating them for very superficial symptoms, get the diagnosis wrong. And people, after years, they say, well, I've been going to all these doctors, I'm getting worse, and so they come looking for us. And these are so simple. I mean, even Shar, with no medical training, she's been with me for 25 years. She's listened to my CDs, listened to hundreds of my lectures, read the books. But she can pick out most of these very quickly just by asking a few questions. And a good, almost half of these are gluten intolerant. The others are sort of secondary gluten intolerance. And so, gosh, these guys are really terrible. You better start learning to do this yourself, folks, because doctors miss it. Yuck. We'll be back after these messages. Okay, Doug, let's go to callers.
All right, let's head to Oregon. And Alan, you're on with Dr. Wallach.
Well, Alan, you're on the air.
Well, thank you, Dr. Wallach. I
Yes,
have a couple questions. The first one I have is I do go to a plasma center to donate my plasma. I figure I have the best quality blood they got, and so I give them the opportunity to take my plasma. And while I'm down there, I'm talking to a guy who has a son that has Duchenne's muscular dystrophy.
Okay.
And I was telling him about, what you've discovered and, what the cause, cure, and prevention of it is. He said, well, no, this is different. Same as like Beckett's. And I said, well, you know what? I honestly don't know. I said, I'll call the doctor and I'll ask him and we'll find out the right answer. So,
Sure. Okay, good question. Well, the different types of muscular dystrophy, there's like about 14 different types, is random chance. It's kind of like when you get a fracture, when you have osteoporosis, you might have a fracture in your right thigh, you might have a fracture in your left tibia in your lower leg, you can have a fracture in your forearm, you can have a fracture in a vertebrae, you can have it's just random chance where it happens. Okay, the same thing when you have these different types of muscular dystrophy, it depends on, in addition to the basic minerals that are missing, it depends on what other minerals are missing. If you have copper deficiency, you're going to have one type. If you're going to have manganese deficiency, you'll have another type, that sort of stuff. But when you take the 90 essential nutrients, get on a gluten-free diet, take the extra selenium, it always goes away. Now, the younger they are, do you know how old this child is?
he is 17.
17, okay. It might take him, 17 years old, it might take him 90 days to see some real dramatic results. It might take him up to, say, 2-3 years to get complete relief because he's been sick for 17 years. A 3-year-old kid, usually within 90 days, is gone. And I deal with 25-year-olds and 40-year-olds. And, of course, after the 40-year-olds, it takes them 5 years. They're not going to die from muscular dystrophy, but they get better and better and better. But they're all gnarled up in a wheelchair and all that kind of stuff. And so it takes them 5 years. But 17, 18, 19 years of age, he should see some dramatic results within 90 days. And we're looking at the UC Davis walk test. And you can see progress in these simple walk tests and things. And these are the things we do, but everybody will get benefit. Okay, it doesn't matter what type. It's an artificial classification based on other sort of side events. Okay, second question, Alan.
Second question is, I was having some problems with when I would swallow, it felt like I wasn't digesting my food right, or it would get stuck somewhere in my esophagus.
Okay, we've got to run to one of those message moments, so hang on. We'll talk about that in just a moment. We'll be back with more Truth, Justice, and the Longevity Way, and Dead Doctors Don't Lie after these messages. Okay, Doug, let's go right back to Oregon and Alan. Okay, swallowing difficulties. It's possible to have obstructive problems in your esophagus from simple things like fibromyalgia, the muscles in the esophagus. You could have things like muscular atrophy. And so at certain points where you just can't move food along, you could have more serious problems. Might not hurt to get some kind of ultrasound of your esophagus. Make sure you don't have some obstruction, of a mass of any kind or an old fish bone in there or something. Never hurts to take a look with a high-resolution ultrasound with no radiation. I would look at that. And then you want to be sure you chew your food well. Make sure that you don't have any big chunks of anything like steak going down in there, or even big pills sometimes. Don't take them by themselves. You want to make sure you flush them down with some water, so because sometimes you may not be making enough mucus in your esophagus, and it's dry, and it's difficult to get stuff down there if it's dry. Or you could even have obstruction of your spinal nerves coming out in your neck and your upper back, and even the 10th cranial nerve out of your skull, which helps control your esophagus muscle movement. So these are all possibilities. At any rate, 90 essential nutrients, stay away from the bad stuff. Give us a call every couple of weeks. Okay, Doug, let's go to callers.
All right, let's head to Georgia. And Patty, you're on with Dr. Wallach.
Hello, Patty, you're on the air.
Hi, Dr. Wallach. I recently found out that I have 4 lumps in my left breast, so I went to my gynecologist, and he diagnosed me with fibroadenoma, which is a fibromyalgia glandular tumor, but it's benign. And obviously, he wanted me to get an excision of the lump, but I'm scared that might deform my breast. Mm-hmm. So I wanted to ask you what would you advise?
Okay, let's see. How old are you?
I'm 28.
Okay, what do you weigh?
I weigh 170.
Okay, how tall are you?
5'4".
Okay, 5'4", 170. Okay. And do you have any other issues, any diabetes or arthritis or anything like that?
No, I just, the last year I suffer from anxiety attacks, but recently I haven't had any of them.
Okay, good. I'm sorry, what do you weigh again? 170, did you say?
170.
Yeah, okay. Okay, Shar?
Yes, Doc.
Okay, this is kind of a Shar thing. Let's see, what would you do for her basic program, 170 pounds? What would you give her as a basic program?
She needs 2 just healthy start packs.
Very, very good. Okay, now what would you do? This is kind of a dysmenorrhea, sort of fibrocystic breast disease kind of thing. Hang on. We've got to run to one of these message moments, and Shar and I will be back, and we'll give you a complete program here. Okay, Patty, we'll be right back after these messages. Okay, Doug, let's go right back to Georgia and Patty. Okay, Shar, we agreed that she should have 2 at 170 pounds. She should have 2 of the basic Healthy Start packs. And what would you give her to deal with this sort of woman's breast thing? It's very common, actually, is fibrocystic breast disease, benign. What would you give her?
I would give her the Woman's FX, but I also would think if it was me, I would take the Oxybody too.
Okay, get down some of the inflammation, absolutely. At her body weight, I'd have her take 2 ounces of Oxybody a day, 1 at breakfast, 1 at dinner, an hour before breakfast, an hour before dinner. You want to take it before you have meals, get maximum benefit from the Oxybody. That'll be 2 quarts a month. And then throw in, as Shar says, the Woman's FX. Again, you could have 2 ounces a day of the Woman's FX, 1 ounce with breakfast, 1 ounce with dinner. It's 2 quarts a month. It's a 150-year-old formula that deals with these sorts of things. And so you'll be very, very pleased with the result. If you have discomfort there, you can actually get a wide-mouth jar of our CM cream, and you can apply the CM cream topically to that area where the cysts are, and it will just almost within 10, 15 minutes relieve swelling, edema. It'll relieve inflammation, and therefore reduce discomfort. And then you might get discomfort relief for 3 to 5 hours. Give us a call every couple of weeks if you would, please. We'd love to hear from you, Patty. Okay, Doug, let's go to callers.
Let's head to Florida. And Marcia, you're on with Dr. Wallach.
Yes.
Hello, Marcia.
Yes.
How can we help you?
Yes, I have the issues. They said the doctor said my blood pressure is very high, my sugar. I had amputation on my toe, and they said my heart is bad and my kidneys. So what can I do for that?
Okay, now you said you have diabetes?
Yeah,
Type 2?
Yeah, and I have high blood pressure.
High blood pressure, artery disease, you've had a toe amputated, and there was another thing.
They said my heart is bad, and my kidneys.
Oh, kidneys, that was it. Now, are you on dialysis?
No, not yet.
Not yet, but they're talking about it, huh?
Right.
What do you weigh? What do you weigh, Marcia? What is your body weight?
134.
Okay, 134 pounds. Okay, Shar, what would you do here? You know, she's got this same old picture. That, of course, the kidney problems can produce high blood pressure. She got heart problems. Do you know what kind of heart problems you have, Marcia? Do you have a name for it?
No, they didn't tell me.
Did you say you have heart problems? Okay.
Yeah, they want to do a probe. A probe. I think it might go in my heart.
Okay. You have artery disease, and then you have diabetes. Okay, Char, what would you do? This seems on the surface complicated, but what would you do?
It's not that complicated, really. I would give her the healthy blood sugar pack and add the selenium and the ultimate daily to that.
Okay. And let's see here. What would you do? What would you do for her overall inflammation?
CM cream. That'll help the inflammation.
Yeah. Okay. Well, when you got high blood pressure, heart disease, kidney failure, artery disease, heart disease, diabetes, what underlying thing might she have?
She probably does, but I would get on a gluten-free diet.
There you go. Exactly right. Get her on a gluten-free diet. Absolutely. And then, as you say, at 134 pounds, I'd give her one of the healthy blood sugar pack, but I'd also get an extra bottle of Sweeties so she could have 3 Sweeties twice a day. I would get her the Ultimate Daily Tablets, 3 of those twice a day. That's 1 bottle a month, and that's going to support and promote healthy blood pressure and also support and promote healthy blood flow through the kidneys and help support healthy kidney function. And what I would like to have is in 2 weeks, Marcy, I want to know your blood sugar levels. I want to know your blood pressure. I want to know things like your pulse and your blood pressure and everything. Give us a call every couple of weeks. Let us know your weight and so forth and bring us up to date. Okay. Let's see here. Doug, do we have time to start another one?
Oh, certainly. Let's head to Missouri. And Cheryl, you're on with Dr. Wallach.
Oh, Cheryl, you're on the air.
Hi, how are you?
Fine, thank you. What's up?
My mom has Alzheimer's. At least that's what she's been diagnosed with. And I got your information, your book and CD on, and I heard the testimonial about the guy that you treated, and he overcame it. I was trying to find out exactly what I could give her.
Okay, what does she weigh?
She's 103 pounds.
Okay, tiny lady. How old's your mom?
She's 81.
Okay. Does she have any other issues? Does she have diabetes or arthritis or anything?
She's being treated for high blood pressure, high cholesterol, and congestive heart failure.
Okay, so she's being treated for cholesterol, high blood pressure, and I'm sorry, you said another one?
Blood pressure, cholesterol, and she has congestive heart failure.
Okay, congestive heart failure. Okay, that was it. Now, is she on medication, you said, for her cholesterol?
Yes.
Okay, Char, what would you do here? Here's a gal with dementia, diagnosed as Alzheimer's disease. She's on medication for high blood pressure, congestive heart failure, cholesterol.
Well, the cholesterol medicine causes diabetes and Alzheimer's disease. So she needs to get off of that immediately.
Exactly. Even the FDA in February of 2012 said that statin drugs and lower cholesterol, particularly Lipitor, is responsible for increasing the risk of type 2 diabetes, as Char says, by 52% and Alzheimer's disease by 100%. So you immediately must get your mom off of the cholesterol stuff. And congestive heart failure is actually caused by a deficiency of a single vitamin. We've known that since 1742. A Japanese naval surgeon by the name of Takaki discovered it. But he was a yellow guy, and so all of the European doctors said, well, if it's not diagnosed by a white European doctor, we can't believe his data because he's a yellow guy. And so we've known this since almost 300 years, and yet medical doctors still don't pay attention to it. But have you seen people get off their diabetes medication, Char?
Yes.
More than once?
If they do what they're supposed to do, it always works.
Now, is this a fluke, or did you see it more than once?
Oh, no, I saw it many, 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 many times.
Maybe 100 times?
At least, yeah.
Yeah, at least, yeah. Maybe 1,000. Okay, here we go. 103 pounds, we have your mom. Take, congestive heart failure. I'd have her take one healthy brain and heart pack per month. I'd have her get the Ultimate Daily Tablets. As Char said, have her take 3 of those twice a day. That'll be 1 bottle a month. And for the congestive heart failure, I'd also throw in the de-stress capsules. 3 of those twice a day, be 2 bottles a month. And I'd get her off of all the bad stuff. No fried foods, no processed meats, no oils, no, no gluten, no wheat, barley, rye, and oats, and certainly no sugar, because sugar makes the congestive heart failure worse. And then call us every couple of weeks. We want to know your mom's blood pressure, We want to know her pulse. We'd like to know her weight, because sometimes they'll lose a little bit of weight, and if they have congestive heart failure, they'll maybe even you lose a little weight because they will lose all the fluid they're collecting. So give us a call. These things can resolve themselves very, very quickly here. In the Alzheimer's disease, let us know how she's going in that category. There's many different types of Alzheimer's disease. And oh, yeah, don't forget, she's got to eat her weight. I'd have her eat 4 to 6 eggs a day, poached, soft-boiled, or soft scrambled in butter. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young Today, 9 for Life Crusade. And Doug, let's go right back to Missouri and Cheryl. And second question.
My second question is, my son has sickle cell anemia.
And how old is he?
He's 30 years old now.
Okay, when was he diagnosed?
At birth.
Okay. All right. Now, sickle cell anemia is not genetically transmitted, as doctors would have you believe. It's actually an inborn error metabolism, and the great details are in the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Linus Pauling, the guy who spent his entire career looking for the gene for sickle cell anemia, worked with hemoglobin. I mean, he knew he could find that gene, but he could never find it because it never existed. It's actually a inborn error metabolism. When the pieces in the bone marrow of that baby were being developed, when the baby was an embryo in the first 3 to 7 weeks of pregnancy, you were missing something, and of course the mechanics and the chemistry of how to make perfect hemoglobin was left out, okay, because you're missing something in your diet. And so what happens now is we can make up the difference, and I published this in 1983. It was based on work that I did in the 1960s and 70s. There were 17,000 autopsies in 454 species of zoo animals and 3,000 humans. And it's in a book that's in the Smithsonian Institute. And this is how I began to work with sickle cell at the Sickle Cell Foundation of Georgia in 1991. Okay? And basically, to make up the difference here, you got to stay away from all the bad stuff, all the free radical stuff that's going to inflame the red blood cells and cause them to sickle. Absolutely no fried foods, no processed meats, no oils, no gluten, no wheat, butter, and oats. And then, what does your son weigh?
He's probably 158 pounds.
Okay. Then I'd give him 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month. I'd also have him take the de-stress capsules, 3 of those twice a day, okay, and a full dose of everything of the healthy brain and heart packs, be a full dose of breakfast, full dose of dinner, and 3 of the de-stress capsules of breakfast and dinner. As long as he does that, he'll not have a crisis, okay? If he's having 1 crisis a month or 1 crisis a week, that will all disappear. We do this over and over and over, but this is a lifetime thing. You cannot cure it, but you can manage it better than just hoping and praying it goes well. And so that's very important. And also, if young women do this, when they get pregnant, when they get old enough to have their own families, we can eliminate sickle cell anemia for all generations. But we're going to have to be really focused and obsessive about making sure prior to pregnancy you're taking all 90 essential nutrients. And this includes 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And then after the baby's born, if the baby has sickle cell, they've got to be managed that way and get rid of all the inflammatory stuff. And they won't have any crises, and they should not die from any complications of sickle cell. It used to be in black communities it was sickle cell, and white communities it was thalassemia. And now they're admitting as when you have sickle cell, it could be in white community, black community, Asians, Hispanics, Arabs, it doesn't matter. It all has to do with mama missing something when the hemoglobin mechanism is being formed in the bone marrow of the embryos. And, of course, that's called an inborn error metabolism rather than a genetically transmitted disease. And I urge everybody to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, and you'll begin to understand that the genetic theory is gone. It's another one of those failed medical theories that has bewitched the world, the industrialized world, for maybe close to 100 years now, and it's gone. The genetic theory of disease transmission is gone. If you're able to give your genes, your DNA and RNA, everything they need, particularly when you're an embryo, you'll be able to eliminate all diseases. It's that simple. Okay, all the diseases are said to be genetically transmitted or not. Okay, including sickle cell. It's a very simple disease. And so thank you so much for asking that question. Again, this was first published, this concept of epigenetics with sickle cell was first published in my book, which is in the Smithsonian Institute as a national treasure, based on 20,000 autopsies, 17,000 change of 454 species of animals, and 3,000 humans. Well, thank you, Shar. Super job as usual. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.